Hey, this is Trez and David, and we're going to go over how to sign up for Medicare Part A and B. So, what's Part A and Part B? Part A is hospital insurance, and that covers hospital stays, skilled nursing facility care, hospice care, and some home health care. Part B is medical insurance. It covers doctor visits, specialist lab work, MRI, CT scans, and durable medical equipment, also known as DME. So, Medicare has four parts. Part A and B are the foundation. So, the hospital insurance and medical are the foundation. When can you enroll? So, most people can enroll during their 7-month initial enrollment period. 3 months before turning 65, their birth month, and 3 months after turning 65. So that's a 7-month initial enrollment period. Enrolling during this window helps you avoid late enrollment penalties. And how do you sign up? So you have 3 easy options. The first one is what David and I recommend. It's going online. So if you have a tech-savvy kiddo, if you have a tech-savvy grandkid, we recommend you setting up an account through Social Security.
It's the most streamlined process, the fastest way to go about doing this.
And you don't have any long wait times, which is most important. The second option is you can call the Social Security office, and that number is 1-800-772-1213. And the third option is going in person to your local Social Security.
Pre-COVID, they would do walk-ins. Post-COVID, they're not doing walk-ins, the last time I heard. So I wouldn't even bother doing that in person if you could avoid it. If you do schedule an in-person appointment,
you're at the mercy of their schedule.
Be prepared to be waiting a week, 2-3 weeks. So again, the more streamlined process, as it is now, is doing it through the Social Security SSA.gov site.
Yep. And then do you automatically get Medicare? So if you're already collecting Social Security, yes, Medicare is usually automatic. And if you are receiving railroad retirement benefits, yes, Medicare is also usually automatic. But if you are not receiving either of those benefits, you will likely need to enroll yourself, which are the options that we just talked about, which is either online, calling the Social Security office, or making an appointment with your local Social Security office.
It's a Monday.
Yep.
So I'll go over this real quick. I'll go over this real fast. Complexities. I don't like really touching on this just for the simple fact I am not Social Security, and Social Security, this is their lane. But overall, there's a couple of different things. If you're still working past the age 65 and have that active coverage, that is considered credible. If you retire at the age of 65, do not pick up Part B, but keep the retirement coverage from your previous employer, and then later on, drop it, get Part B, and then an advantage or a supplement policy. Each 12-month period you went without having Part B, post-working, you have a 10% penalty, and it can add up. The employer size, the current coverage, again, a lot of complexities. The rule of thumb, call Social Security, hearing it from the horse's mouth itself.
Okay, and when does Medicare coverage begin? So your Medicare start date depends on your specific situation. When you are 65 and not collecting Social Security, your coverage begins the first day of the month you turn 65. So if your birthday is May 15th, your coverage begins May 1st. If you are collecting Social Security and you're 65, your coverage begins the first day of the month you turn 65. So for example, if your birthday is September 20th, your coverage begins September 1st. And if you are collecting Social Security before 65, your coverage begins 24 months after your Social Security benefits start on the first day of that month. So you need 2 years of collecting Social Security, and your start date affects when you can use your benefits. So make sure that you guys are keeping track of that. And if you have any questions, feel free to reach out to myself or David. Our numbers are on here. Call, text anytime if you have any questions. We're here to help. We're here to inform. Can you think of anything else?
It's all overwhelming. We try to keep these videos under 5 minutes long, but feel free to text us. Again, we're not confined to a 9 to 5 schedule. We know this can be overwhelming, so we are truly here to help guide you. See you in the next video.
See ya.